A wake-up call for heart health. 99% of heart attacks and strokes have a common thread. In a groundbreaking study, researchers have uncovered a startling connection between 4 common risk factors and an overwhelming majority of heart attacks and strokes. This revelation, based on an extensive analysis of health records from South Korea and the United States, sheds light on a critical aspect of cardiovascular health that affects us all. The 4 key risks identified are high blood pressure, high cholesterol, high blood sugar, and tobacco use. These factors, often intertwined with cardiovascular disease, pose a significant threat to our heart's well-being. But here's where it gets controversial. The study suggests that these risks are not always recognized or addressed early on, leading to potentially devastating consequences. Led by Dr. Hokyu Lee from Yonsei University College of Medicine, the research team tracked over 9 million adults across both countries. Among those who experienced a cardiac or neurologic event, an astonishing 99% had at least one of these risk factors present beforehand. And this is the part most people miss. Even in seemingly healthy individuals, these risks can silently accumulate, setting the stage for a heart attack or stroke. High blood pressure, for instance, strains the heart and blood vessels over time. Similarly, elevated cholesterol and blood sugar levels can slowly damage arteries. Tobacco use, while less prevalent, still contributes to this deadly quartet. The study's approach, focusing on early detection and prevention, highlights the importance of routine checkups and lab tests. But why do these non-optimal levels matter? Well, imagine your body as a finely tuned machine. When blood pressure, glucose, or lipids are slightly off kilter, it's like a tiny leak in a pipe. Initially, the body can handle it, but over years, the strain builds, and the risk of a catastrophic event increases. Many people live with these subtle imbalances, unaware of the potential danger. The study's findings are particularly relevant for women under 60. Contrary to the belief that heart failure and stroke strike without warning in this demographic, the research shows that over 95% of events are preceded by at least one non-optimal risk factor. This underscores the need for early intervention and management of blood pressure, cholesterol, and glucose levels throughout adulthood. An accompanying study further emphasizes the gap between risk and care. People often have multiple clinic visits before experiencing an event, yet these opportunities to test, treat, and manage risks are sometimes missed. The good news is that effective treatments and lifestyle changes are within reach. Controlling blood pressure, cholesterol, and glucose, along with smoking cessation, can significantly reduce the risk of cardiovascular disease, the leading cause of death in the United States. While the study doesn't claim to have all the answers, it highlights the urgent need for stronger control of these 4 common risks. By recognizing and addressing these factors early on, we can potentially avert countless tragedies. So, the question remains, how can we ensure that these risks are identified and managed effectively? Share your thoughts and let's spark a conversation about heart health awareness and prevention.